Hi, welcome to the April 2026 Rapid Update in Therapeutic News. I'm Tessa Lewis, GP with interest in therapeutics and care of older people. I'm going to focus primarily today on the updated guidance from NICE on the management of type 2 diabetes in adults. But before that, just to highlight some other recent guidelines. So NICE has extensively updated its guidance on the treatment and assessment of fertility problems. The MHRA has strengthened warnings about the risk of addiction, dependence, withdrawal, or tolerance for the gabapentinoids, benzodiazepines, and ZEB drugs, and that's in the product information and on packaging. And they've also provided updated guidance on the GLP-1 medicines. But I'm going to spend the next few minutes focusing on the NICE diabetes update. And the theme in this guideline and the first recommendation is about tailoring care to a person's need. So taking account their preferences, but also their other illnesses, their risk of polypharmacy, and the likelihood of benefiting from long-term interventions. We know that diet, physical activity, healthy living, education and support is fundamental to the care of people with diabetes or pre-diabetes. And NICE have provided some useful links to help with this, including this NHS Better Health website, which is a really useful starting point. And we can also point people towards the NHS Wales Healthy Weight, Healthy You website. When thinking about medicines, we need to start by assessing the risk of cardiovascular disease, the existing cardiovascular status, and renal disease. If frailty is a concern, NICE advises to assess it before starting medicines. And this guideline splits into separate pathways for different comorbidities, including a separate pathway for people with no comorbidities and people with early onset, so diabetes, so before the age of 40. And the next slide is a summary table for the options for these different scenarios. And it includes atherosclerotic cardiovascular disease, heart failure, chronic kidney disease, obesity, and frailty. So I don't expect you to be able to read the detail of this, but it's a visual summary on type 2 diabetes in adults choosing, reviewing, and changing medicines. And it gives an overview of the medicines recommendation. It can be found on the NICE Diabetes website under Tools and Resources or from a link within the guideline recs. So the initial treatment option per comorbidity is in the black box. And for most comorbidities, it's now modified release metformin and an SGLT2 inhibitor or flozin, such as dapagliflozin. The next box down, the blue box, is alternative regimes, which is where metformin is not tolerated or is contraindicated. So, for example, people with an eGFR of less than 30. The advice is to start the medicine sequentially, not at the same time, so establishing the maximum tolerated dose before adding in a second-line medication. And if people are quite happy with their immediate release metformin, it's well tolerated, then there's no need to change it. For people with type 2 diabetes and frailty, the advice is a little bit different, and to only offer an SGLT2 inhibitor or flozin if the person's level of frailty doesn't place them at risk of an adverse event, so such as volume depletion or hypotension. And similarly, the advice about relaxing HbA1c targets if people have a shorter term reduced life expectancy or a tight glucose control will put them at high risk if they develop hypoglycemia, so for people at risk of falls or where intensive management wouldn't be appropriate. So currently there are two different visual summaries available to help choosing medicines, and the next slide I'll just show you the different layouts. So this alternative visual summary also gives the treatment options per comorbidity, right up to the point of needing insulin. And if people have more than one comorbidity, the advice is to agree with the person which one to prioritise. You're probably already doing this, but just a quick reminder of some of the advice when initiating SGLT2 or flozins. and advice to patients. So reminding them that they work by increasing the glucose excretion in the urine, with potential side effects including volume depletion, low blood pressure, dizziness, increased risk of infection, particularly fungal genital infections, and risk of hypoglycemia. So again, reminder if someone's asking about dysuria, ask about rashes down below. Important to inform people about the risk of diabetic ketoacidosis. And as per MHRA, we need to test for raised ketones in people with these symptoms and signs and advise them to seek medical advice. We also need to remember that a low carbohydrate or ketogenic diet would increase that risk of diabetic ketoacidosis, and also give the sick day rules. The NHS app, as always, on medicines, it's a very useful resource for patients. So NICE advises to give clear sick day rules in a person's individualised treatment plan depending on the medicines that they are prescribed. And your organisation may already have leaflets on SGLT2 inhibitors or sick day rules, but I find this one from the UK Kidney Association helpful. And generally, medications can be restarted once the person's feeling better and eating and drinking for 24 to 48 hours. But obviously, you have that individual risk assessment. So thinking about this scenario, what would you do? So you get a message to reauthorize the medicines for Mr. Llewellyn. He's 81. You've only got some of the information here, obviously, but his past medical history includes 2001. He was diagnosed with hypertension, then obesity, and he had type 2 diabetes diagnosed in 2007. He's got OA of knees, he's had a total knee replacement, and he's got hypostatic hypertrophy. And here is his results, which are pretty good, aren't they? HbA1c of 43, listed satisfactory in his BP's 129.81. So what will you do? So as he's got old, he's gradually lost some weight in recent years. He's becoming frailer, and maybe these results are just a bit too good to be true. So a reminder to ask about dizziness and falls, think about frailty, and consider deprescribing, making those shared decisions. And so again, NICE reminds us for frailer people at medication review, ensure that they're taking the smallest effective number of medicines at the lowest effective dose. So these are some of my key points from this updated guideline, but there's lots of changes. Do check it out for yourself for all the detail, and have a look at the visual summaries to help update your own guidelines. Thank you very much for listening.